Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
So now in the dry eye, investigations of dry eye. Okay, dry eye can be investigated by different tests. Okay, first we have tear breakup time. Okay, this tear breakup time can be calculated by different methods. Like you can use different staining methods can be used like rose bengal staining or fluorescent staining, or we can use lissamine staining. So in all these, with all these stains, if the tear breakup time is normal, means that is there are 30 to 34 seconds. If there are 34 seconds, that is if the tear breakup time, that means normally when you close the eyes, and then if you open the eyes, then the tear is formed uniformly in the whole of the eye. It is formed uniformly. But once you open the eyes for a longer period of time, the amount of time, in some individuals the tear will break up, and this breakup of tear is calculated. Normally the tear breaks up by 34 seconds when you open the eyes, but in some individuals it can break up in less than 10 seconds. If the tear breaks up in less than 10 seconds, it is called as dry eye. Then other investigations are, we can do skimmer test can be done. Okay, in skimmer test, actually this is a type of fluorescent dye containing strip. So that strip is put in the eye. Okay, that strip is put in the eye, and then you will see the changes. Like for example, if this is the fluorescent, this is the strip which is put in the eye, and this strip has the readings. So where does this readings, or till where the readings go, we see. So normally the tear in the skimmer test, the tear will go normally up to 15 millimeters. If it goes up between 5 to 10 millimeters, it is borderline. If it is less than 5 millimeters, then it is abnormal. So this is skimmer test. Then we also have one more test which is called as phenol red thread test. In phenol red thread test, a thread is uh, taken, and this thread is dipped in the phenol red, and it is put in the eye, and you will see whether there is this dry eye is there or not. Then in the dry eye, we have rose bengal staining for dry eye, looks something like this. So this is the rose bengal staining for dry eye. Then you can also do a lactoferrin levels are can be tested in the tears. If we test the lactoferrin levels in the tears, this lactoferrin levels were decreased in the dry eye in tears. And we can also do a tear osmolarity measurement. Tear osmolarity measurement is mainly raised in patients with dry eye. In patients with dry eye, tear osmolarity measurement are raised. Right.
thank you and thank you for watching.